Um, we are grateful that you are in North London. It so happens to be the community where Dr. King came to in 1966, standing up for justice, for the rights of the poor, for health care, for housing. So it's just ironic that we're here. And listen, while we're here, while I'm warming everybody up, I want you to give it up, because we are united on this front. Give it up for all of our healthcare leaders. You guys can encourage them. They let us through the pandemic, they've been there for us, gave birth to our babies, everything, right? So one more time, let's celebrate them. 2371 Senate Amendment 2. This is a bill that we all agree upon. We're up. So at this time, during this press presentation, Mo, Perla, Dr. Ezike, Dr. Green, Rep. Moeller, and Rep. Ford at that time. All right?
My name is Chelsea Johnson, and I serve as the board chair for Lawndale Christian Health Center and a resident of North Lawndale Community. Today is about the patients and the families who depend on their local doctors and hospitals and worry about whether they can afford their next prescription or doctor's visit. We need to get the HB 2371 bill passed. It saves lives, literally.
My name is Maumero Drago, and I have the honor to be the Chief Executive Officer of Access Community Health Network. So at Access, we serve 150,000 patients every year. And we are here today because, again, we want to call on our Illinois legislators to pass the Illinois House Bill 2371, Senate Amendment 2. Right? And why do we want to do that? Because 340B is a lifeline for not only our patients that have to make a life and death decision every day between choosing to pay for drugs or other necessities of life. We are here because 340B is also a lifeline for every single community health center, every safety net hospitals, and our hospitals partners that are here. Because without 340B, we can't cover the high cost of healthcare. Without 340B, we can't invest into our communities in terms of job, in terms of facilities, because most of our members, our employees, at Access, over 1,100 of them, work or live in those communities that we serve. So we, as healthcare entities, we are the backbone of our healthcare system. Without community health centers, without safety net hospitals and our hospital partners, the healthcare system will collapse. So pure and simple, 340B, we need that bill to pass because that's the difference between us being here and not being here. So with 340B funding, community health centers, safety net hospitals, our hospital partners, will continue to be here serving our communities and our patients, and it's really that simple. So with that, one of the things that keeps me going every day is our patient voice. And one of our most passionate patients would also happen to be our board member, our board secretary, Perla. I'm going to bring her here so she can share her testimony. Thank you.
Good morning, everyone. My name is Perla Herrera. I am a two-time cancer survivor. And I'm a patient and a consumer board member for Access Community Health Network. I am living proof that 340B saves lives. Here I am today. 340B affords me the ability to get life-sustaining medications, to have a better quality of life and a healthy life overall. And it really all comes down to cost. Everyone should have the ability to have life-saving medications. And really, when I say the cost, I'll give you an example. You know, a lot of us have to, and I'm coming out of this thing wrong, but here. My medication for cholesterol, which is something that everybody here understands, probably runs me $276 normal cost. 340B allows me to stay alive and to be okay, to get healthier by paying $1.60 a month. And that's really the difference, ladies and gentlemen, between me being here today, waking up this morning, taking a breath, being here today, or my other address would be the cemetery. The truth. So, you know, please, I ask our state legislators to please call the bill, vote yes for me and for thousands of other patients that rely on this. We all deserve life-sustaining medication at an affordable cost. Save and protect 340B. Vote yes, please.
Good afternoon. I don't know what else needs to be said after Ms. Perla. Thank you so much. Thank you for being a living testimony to why 340B is so important. Thank you. Good afternoon. I'm Ngozi Ezike, President and CEO of Sinai Chicago. We are the largest private safety net healthcare system in Illinois, and this 340B program, as you have heard, is essential to keeping our communities healthy. It allows hospitals like Sinai, like other hospitals, to provide affordable, critical medications, to let our patients go home with them after discharge, whether it's low-cost insulin or infusion therapies, cancer medicines. It also allows our physicians and caregivers to stretch the very limited federal resources that we have to deliver those life-saving services to our communities. I think about our caregiver, a specific caregiver who came in suffering a stroke. She had no insurance. She needed critical, essential medicines. Because of the 340B program, we were able to provide her with Entresto, Jardiance, Eliquis, all the critical medicines that she needed, and were able to have her have them at home after discharge. So she went home with the medicines she needed thanks to 340B, and she never ran out of the medicines. It literally saved her life. This is not about money. This is about lives. We are standing up for those who are too often left behind, who are too often forgotten about. This is our collective mission to care for those in need. The legislation is here. It's ready. It's ready now. It's time to act and protect 340B. It's time. It's time for our legislators to vote yes for House Bill, which one is it? 2371. Thank you.
Good afternoon, everybody. My name is Dr. Lisa Green. I'm the CEO and one of the co-founders of Family Christian Health Center. And here with the providers on this stage that represent the people in the field that do the work, that we took an oath to do no harm. And when you take an oath like that, we hold that dearly. And so because of this bill, it is making us and giving us the opportunity to do what we signed up to do. Without it, it does the opposite. I had a patient just last week, who came in. She had lost so much weight, but her blood pressure was so high. I was like, what's wrong? She says, Dr. Green, the medicine that I paid for the prior month, that I was 3 of them that I was able to get, I paid $260 for. This month, it was $1,100. She said, I can't afford that. My husband and I both work. We're not too proud to go to a pantry, but they're open during the day. I can't go on Saturday because I work on Saturdays for the overtime. So what choice do I have? We had to spend hours on the phone calling to try to get that prescriptions down to something that she could afford. And the best that we could do was $400. But she still paid the $400. There's thousands of stories that each of us could tell. But if you look at it, the people in this room, we got the power, we have the energy to change that. If you think about it, Fairview Christian Health Center is on the far south side. And we know the west side don't go to the south side and the south side don't go to the west side. We know, but in this room, we got the east side, we got the west side, we got the north side, we got Dallas, Springfield, we got the state. We are an amazing city and a state in this country who should take the lead on what's the right thing to do. And all of us are mothers or fathers or cousins or sisters or aunts or uncles or neighbors. So in the signs of what Nike says, all we need to do is just do it and vote.
All right. Good morning, everyone. Good morning. I'm State Representative Anna Moeller. I represent the 43rd District, which is the Elgin area. Thank you. I'm so honored to stand with leaders who fight every day for our community health. Dr. Brooks, Chelsea Johnson, Mohammed Wadrigo, Dr. Ezike, Dr. Green, and Representative Ford. And I'm happy to see Congressman Davis here joining us as well. And with patients like Perla, who remind us of why this work matters. I want to also thank the community health centers and hospitals for their efforts in putting this rally together. I am truly overwhelmed by the turnout we have here and the enthusiasm and passion we feel in this room. We are here because access to health care is a human right and a civil right. And access to affordable medication is not a luxury, it's a lifeline. I am very proud to sponsor House Bill 2371 because too many Illinois patients are being put at risk by restrictions that undermine the 340B program. The 340B program is one of the most important tools that we have to keep medications affordable for low-income families, seniors, and patients with chronic conditions. But we know in recent years, the pharmaceutical manufacturers have imposed new limits and barriers that make it harder for community health centers and safety net providers to deliver discounted medications. These restrictions hurt the very people this program was designed to help. House Bill 2371 ensures that pharmaceutical companies cannot deny, restrict, or interfere directly or indirectly with the acquisition or delivery of 340B drugs to covered entities or their contract pharmacies. It prevents manufacturers from dictating which pharmacies providers can work with or forcing them into arrangements that undermine their operations. I'm very proud that the Senate passed this bill unanimously on May 29th. And I'm proud that the House Executive Committee passed it unanimously a few days later. And now the bill awaits a concurrent vote in the House. I am committed to working with my colleagues to get this across the finish line because as you've heard, this is an urgent need and the consequences of inaction are very real. As I said before, this legislation is a vital step in protecting access to affordable medications for patients who rely on the 340B program. And during the time when the federal government is cutting funding for health care for families across the state, we should be doing everything we can to bring vital resources to support patients and their health care providers. Resources like 340B that cost nothing to taxpayers or the state of Illinois. When pharmaceutical companies impose restrictions, they don't just create administrative hurdles, they jeopardize access to care in communities that already face barriers. Our legislation ensures that Illinois patients can continue to rely on their trusted community health centers, hospitals, and pharmacies for the medications they need. So in closing, I'm very grateful to the providers, the advocates, and patients who are raising their voices and sharing their stories. Together, we will protect the 340B program, safeguard access to affordable medications, and ensure that every community in Illinois has the health care resources it deserves. Thank you so much.
Well, that's Representative Moeller. I got to tell you, if you want 340B passed, you got to give it up for her more than that. When I tell you that she's in Springfield with people that don't understand and don't care to understand, but she's got a steady hand, and she's made peace. And that's why we're going to get this bill passed. Because of Representative Moeller. And let me tell you, this is what democracy looks like. This is what democracy looks like, because there are people today that don't believe that 340B should pass. What do you want? 340B. When do you want it? Now. What do you want? 340B. Let me tell you, Brooks, if he calls my phone again when we're doing budget votes and doing votes to save lives, I don't know what to do. He has a roll call that he wants me to run around the floor and find representatives to find out where they're at on the bill. So give it up for Pastor Dr. Brooks. And let's give it up for, without naming the professions, all of the healthcare professionals that actually save lives in the state of Illinois. We need you, and we need you to have the resources that you need to save lives on the west side, on the south side, on the east side, all across Illinois, and we believe that 340B will do that. Now, when I tell you, House Bill 2371, Senate Amendment number 1, is in the House stall, but this crowd right here, I want the Speaker of the House to know that the people have spoken and they want the bill concurred on now. So let me hear you. Mr. Speaker, call the bill. Call HB 2371. Senate Amendment number 1. Uh-oh, hold on. No, I know it's true. I just want to see if you know which one. Which one is it? All right, Senate Amendment number 2. All right, here, do it again. The doctor, preacher said, do it again. Mr. Speaker, call HB 2371. Now, and Senate Amendment number 2. Thank you. But let's get something understood. That many people they care about federally qualified health centers, here's your chance to prove it. Here's your chance to give the people in Illinois that care for the most vulnerable people the resources that they need. Because, of course, the state and the federal government falls very short on the reimbursement rates to take care of the patients. And for the federally qualified centers and our safety nets to do the work that they need to do to save people's lives with substance use disorder, cancer patients, and people that just want to have preventive care in this country, we have to make sure that we lead the way in Illinois by passing this bill. And so with that said, Representative Moeller, thank you for being a leader, thank you for being a steady hand, and thank you all for showing us what democracy looks like right here on the west side of Chicago. But before I close, I have to say that there is a place that I envision in this room, being a pharmacy. We need it. There's a map, and I could share it with you. There's a need for pharmacy access in Lawndale, in Garfield. We must have that right here on the west side of Chicago, and I believe that 340B can help that happen. And in closing, I need to thank Congressman Davis, who is the godfather of FQACs and safety nets at the federal level, who continues to give us guidance and support. Give it up for Congressman Kevin Davis.
What Ford said, what we came here for, all right? Listen, we're going to be blessed to have Congressman Danny Davis speak in a minute. We're going to bring the band back. But what we need you to do right now, we need you to fill out those postcards. We need you to sign the letter that we have back there. It's in the back there somewhere. Sign the letter that we have for the Speaker of the House. So that's the role you can play right now. Mingle a little bit, enjoy the music, and then when we come back, you're going to hear from Danny Davis and a couple of others, and we're going to get this bill passed. Right? We're going to let you know what the marching orders will be, because we're not taking no for an answer. All right, one more time. Give it up for our healthcare leaders, y'all.